ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆಗ್ತಾ ಇದೆ. ಈ ರೀಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟು ನಾನು ನೋಡಿರೋದು ಫಸ್ಟು, ಕರ್ನಾಟಕದಲ್ಲಿ ಫಸ್ಟು, ಬಹುತೇಕ ಭಾರತದಲ್ಲಿ ಸೆಕೆಂಡ್ ಕೇಸು ಅಂತ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಅಂಥ ಒಂದು ಲಕ್ಕಿ ಪರ್ಸನ್ನನ್ನು ನೀವು ನೋಡ್ತಾ ಇದ್ದೀರಾ. ಆ್ಯಂಡ್ ಆಸ್ಟರ್ RV ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಇಷ್ಟೊಂದು ಕಾಂಪ್ಲಿಕೇಟೆಡ್ ಆಪ್ರೇಷನ್ ಮಾಡಲಿಕ್ಕೆ ನಮ್ಮ ಹತ್ರ ಎಲ್ಲ ಫೆಸಿಲಿಟೀಸ್ ಇದೆ. ಸರ್ಜನ್ಸ್ ಆರ್ ಟ್ರೈನ್ಡ್ ಆ್ಯಂಡ್ ಬ್ಲೀಡಿಂಗ್ ಕಾಂಪ್ಲಿಕೇಷನ್ನು, ಏನೇ ಕಾಂಪ್ಲಿಕೇಷನ್ ಇದ್ರೂ ಟ್ಯಾಕಲ್ ಮಾಡಲಿಕ್ಕೆ ಎಲ್ಲ ವ್ಯವಸ್ಥೆ ನಮ್ಮ ಹತ್ರ ಇದೆ.
16 to 2021-22 ತುಂಬ ಹೆಲ್ತಿ ಆಗಿದ್ರು, ಏನು ಪ್ರಾಬ್ಲಮ್ ಇರಲಿಲ್ಲ. ಸೊ 22ಅಲ್ಲಿ ಒಂದು ಸಲ ಕೋವಿಡ್ ಆಯಿತು. ಕೋವಿಡ್ ಆದಮೇಲೆ ಐ ಆಮ್ ನಾಟ್ ರಿಲೇಟಿಂಗ್ ಟು ದ್ಯಾಟ್, ಬಟ್ ಕೋವಿಡ್ ಆದಮೇಲೆ ಇಸ್ ಪ್ರಾಬ್ಲಮ್ ಸ್ಟಾರ್ಟೆಡ್. ಹೌದು, ಬ್ಲಡ್ ವೆಸಲ್ಸಲ್ಲಿ, ಅಂದರೆ ನಾವು ಗ್ರಾಫ್ಟ್ ವ್ಯಾಸ್ಕುಲೋಪತಿ ಅಂತ ಕರಿತೀವಿ, ಬ್ಲಡ್ ವೆಸಲಲ್ಲಿ ಬ್ಲಾಕೇಜ್ ಶುರುವಾಯಿತು. ಅದು ಒನ್ ಆಫ್ ದ ಕಾಂಪ್ಲಿಕೇಶನ್ ಆಫ್ ಪೋಸ್ಟ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್. ನಾವು ಹೆಂಗೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆಗುತ್ತೆ ಅದೇ ಥರ ಬ್ಲಡ್ ವೆಸಲ್ ಬ್ಲಾಕ್ ಆಯಿತು. ಅದು ಬೇರೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಆದಾಗೆಲ್ಲ ಬರೀ ತುಂಬ ಡಿಸ್ಕ್ರೀಟ್ ಬ್ಲಡ್ ವೆಸಲ್ ಬ್ಲಾಕ್ ಇರುತ್ತೆ, ಇದು ಓಲ್ ಬ್ಲಡ್ ವೆಸಲ್ ಬ್ಲಾಕ್ ಆಗಿಬಿಡುತ್ತೆ. ಆ ಥರ ಆಗಿ ನಮಗೆ 2 ಆ್ಯಂಜಿಯೋಪ್ಲಾಸ್ಟಿ ಮಾಡಿದ್ರು ಅದನ್ನು ನಾವು ಫ್ಲೋ ಎಸ್ಟಾಬ್ಲಿಷ್ ಮಾಡೋಕ್ಕಾಗಲಿಲ್ಲ ಸರಿಯಾಗಿ. ಸೊ ಆಮೇಲೆ ಪುನಃ ರೀಬ್ಲಾಕಿಂಗ್ ಚಾನ್ಸಸ್ ಜಾಸ್ತಿ ಆಯಿತು, ಅದರಿಂದ ಹಾರ್ಟ್ ಡಿಸ್ಫಂಕ್ಷನ್ ಆಯಿತು. ಸೊ ಅದರಿಂದ ಸೆಕೆಂಡ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ಗೆ ಪ್ಲ್ಯಾನ್ ಮಾಡಿದ್ರು. ಸೊ ಸೆಕೆಂಡ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ 2023 ಡಿಸೆಂಬರಲ್ಲಿ ಈ ಅಂಡರ್ವೆಂಟ್ ಸೆಕೆಂಡ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್. ಆಫ್ಟರ್ ಸೆಕೆಂಡ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಸ್ವಲ್ಪ ಕಾಂಪ್ಲಿಕೇಶನ್ಸ್ ಆಯಿತು, ಅಂದರೆ ಬ್ಲೀಡಿಂಗ್ ಎಪಿಸೋಡ್ಸ್ ಜಾಸ್ತಿ ಆಯಿತು, ಮತ್ತು ಒಂದು ಎಪಿಸೋಡ್ ಆಫ್ ರಿಜೆಕ್ಷನ್, ಯಾಕಂದರೆ ಆಲ್ರೆಡಿ ಸೆಕೆಂಡ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಆದ್ದರಿಂದ ಒಂದು ರಿಜೆಕ್ಷನ್ ಆಯಿತು. ಅದನ್ನು ನಾವು ಕ್ಲೋಸ್ ಸರ್ವಿಲೆನ್ಸ್ ಮಾಡಿ ಮ್ಯಾನೇಜ್ ಮಾಡಿದೋ. ಸೊ ಆಫ್ಟರ್ ದ್ಯಾಟ್ ಈಸ್ ಡೂಯಿಂಗ್ ವೆಲ್. ಸೊ ಇವಾಗ 6 months ಆಫ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್, ಸೆಕೆಂಡ್ ಬಯಾಪ್ಸಿ ಮಾಡಿದ್ದೀವಿ, ಬಯಾಪ್ಸಿನೂ ನಾರ್ಮಲ್ ಇದೆ. ಸೊ ಈಸ್ ಡೂಯಿಂಗ್ ವೆಲ್ ಆಫ್ಟರ್ ಸೆಕೆಂಡ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್.
ಥ್ಯಾಂಕ್ ಯು.
The risk gets doubled. In his case, it was really challenging, and that too, this donor alert comes on December 30th, if I remember right. And by the time we could organize everything, it was December 31st. You can imagine, you'll have to motivate your team to work on December 31st, and we finished this successful surgery on January 1st, next year, 24. It was challenging, it was interesting, and we are happy that he's having a good quality life now. So in the post-operative period, he was very enthusiastic person. He was telling his stories. So just to, if time permits, I'll tell his story, and if he permits, I consider this as story of 5 hearts, not 1 heart. Whenever we operate, we deal with 1 heart. In his case, 2018, the first heart was diseased and he got a second heart. So 23rd, the second heart failed and we put a third heart, and that is working on him. And as Dr. Nagmalesh, Professor Nagmalesh was telling his wife, this is an interesting heart, because normally love, I can see the ultimate love in her life. Most of the time, even among lovers, if one partner gets to know that the other person has got some disease or major problem, they tend to go back. But this lady persisted with him, she married him, and they have a beautiful girl, am I right? Yes. So that is the 5th heart I am talking. So this is a story involving 5 hearts, and this message should go to the community, saying that medical field can do many things for a deserving person if they come for help, and it is doable. So surgery can be done, and people will have excellent result, and this is evidence in front of us. And Aster Hospital has got all the facilities, the latest of medical gadgets, and the personnel like us. We can give the best to the people.
I think I since it's already delayed, I won't take much time. I will leave it to Dr. Nagmalesh to talk in detail about the entire transplant program which has been happening, and of course about how this program has, the surgery has happened. Thank you.
Thank you. So Mr. Venkatesh, he actually came to us in 2016 with the end-stage heart disease, and he was in very bad shape that time. So he underwent a transplant without much event, and he was doing well for a very long time, almost like 8 years. So the power of force behind him is his wife and his father. They really helped. Even he was just 24 years when he did first transplant, and she was also, I think, 24 years. So she took a lot of interest to, even though she was not married that time. So I used to see her, to stay in the ward and take care of him, and a lot of commitment from her side. I'm telling you, she's one of the great lady who supported him like anything. So that is a journey they both started, and post-transplant they are very regular. So, but unfortunately, after 8 years of transplant, his heart started failing because of the disease of the blood vessels. We call it as vasculopathy. That is one of the common cause of failing heart after transplant, after 5 or 6 years of transplant. So that what happened among our 70 odd patients we have done transplant. Is the first person who developed this complication. So followed by that, we tried to manage him, postpone his retransplant for almost like 1.5 years. So after that we could not manage because both of his heart was failed, and we had to post him for retransplant. So in 2023 December, that is exactly around 6 months back. So 2-3 months before, when I told the family that he needs retransplant, they agreed, and with lot of trust with us because we already managed 8 years, and they were able to manage everything, the emotions, everything they were able to manage, and we were able to do transplant in 2023 December. So now 6 months post-transplant. We didn't want to expose him early. That's the reason we took almost 6 months for him to settle down completely, then bring him here. So he's doing well. He probably will do long term, have good health. And he went through little complication post-transplant, like bleeding issues and rejection, because we have already done one transplant, and his immunity and the transplanted heart, and it's a second heart. So went through a lot of challenges. We were able to overcome these challenges, and now we have done biopsy, he's fine, there's no rejections, he's doing well.